So, good morning. As people start to filter in, I'll welcome you here to today's Simon Talk with Paula Mayock, who's Associate Professor in Trinity College Dublin, who's going to talk to us about women's experience of homelessness. Just a little bit of housekeeping. The first thing to say is that if you're joining us today for the first time, or if you're on social media, we use the hashtag Simon Talks, and that helps us to find you on our social media and means we can retweet and sort of engage with your engagements. But so if you do use social media, please use the hashtag, and please do. As Paul is going through a presentation, if a question occurs, you'll find the chat button and the Q&A button down below. If you want to pop in your question to the Q&A, but the chat, if that works better for you, I'll ask them of Paula once she's finished her presentation. So that'll be the Q&A section. The one thing I would say, so as you know, we do these Simon Talks, they came out of a period when we were doing a lot of submissions. And I suppose we were gathering up information from academics and other institutions to help inform our positions. And we thought it's always really useful to get that sort of unedited or unprocessed through the sort of our position as the Simon Communities of Ireland. So we started doing these Simon Talks. We've spoken about women's homelessness, I think it's a couple of years ago now, and Paula would have been a part of that. But what's been interesting is the amount of interest in this particular talk has been really, really positive. And I think that's really important because I was talking to Paula earlier, and we do know that kind of gendered element of homelessness, beyond sort of the sense of family homelessness increasing, really has gone off the boil a little bit, and it's really important that we continue to have these conversations. So I'm going to not. I think people are pretty much filtered in. So with that, I'm going to hand over to Paula. Thank you, Paula.
Thanks, Wayne. Good morning, everybody. Thanks for joining this hour. I'm going to share my slides there. I want to thank Wayne for inviting me today. I'm always happy to speak on this topic because it's very often neglected, and I'll be saying a little bit more about that throughout the session. So I thought that just in terms of the format, I'd speak for around 30 or more minutes, and please insert any questions or comments in the chat box, and then I'll respond to them at the end. So what I'm going to look at today, we look briefly at the extent of women's homelessness, and I want to talk then about women's invisibility and about gendered homelessness. And I'm going to go then to look at the service experiences of women experiencing homelessness. And this, I'm going to talk on this topic in relation to findings from research that I've conducted myself, along with Sarah Sheridan, but also the research base internationally. And then I'll move to look at policy and service responses to women's homelessness, and then just draw some conclusions. So looking then to the extent, well, as people are aware, we have seen a rapid feminization of homelessness, and this is evident in many European countries, including Ireland, and in the US and Australia. And Ireland, for a significant number of years now, has recorded a very high proportion of women in its homeless population. And the most recent figures indicate that from December 23, indicate that 38% of adults accessing local authority managed emergency accommodation were females. And this percentage is high compared to other European countries. For example, figures published for Europe in 2023 indicate, for example, that in the Netherlands, only just 17% of the total population were women. In Spain, that figure was 23%, while in Italy it is higher at 32%. But we're not seeing figures in Europe up at this level of 38%. Now, both in Ireland, we also know, and at a European level, family homelessness, of course, primarily impacts low-income women. These women are typically young, they're mothers, and they're parenting alone. Now, if we look then to adult home-only single homelessness, and this is really interesting as well. This new study published by Focus Ireland, and all of this compiled by Ona Sullivan and colleagues at Focus Ireland. The picture in relation to these singles are interesting. And what this research did was it examined the total number of adults without children accessing emergency accommodation between 2014 and 2023. Now, this population is predominantly male, but very significantly, the number of females has increased at a faster rate than males, 171% for females, compared with 133% for males since 2014. And also significant is that this pattern has become more pronounced in the past 3 years, with evidence of a 44% increase in females compared to 34% of males. So we are looking at this, I suppose, landscape that there is a very strong female presence in our homeless population. And just in terms of looking at figures and so on, then when we look to single homeless women, many of these women are mothers who are separated from their children. And very often these mothers are sidelined or not recognized as mothers. And this issue has been looked at, has been demonstrated in Ireland through a number of studies, but also it has really come to the fore in the UK with this recent work of Benson and colleagues there. Now, as I said, historically, women's homelessness has been largely invisible, and this invisibility is evident within both the academic and policy literature or discourses on homelessness. And it's important that, I suppose, we recognise this invisibility. And in fact, homelessness research itself has been critiqued for its gender-neutral approach. And the experiences of homeless women have only received very sporadic attention in the literature. And I was just ahead of the webinar and speaking there to Wayne, for example. The first study of women's homelessness was conducted in 1985 by Stanislaus Kennedy, to looking at women and girls experiencing homelessness. And there was nothing else until I managed to get some funding from the Irish Research Council and started work that was published in the publication. Two reports were launched simultaneously, one on women generally and one on migrant women in 2012. So we see this huge gap. Now, Maeve Savage has done some work in the intervening period as well, but really very sporadic research attention. And likewise then, policy discourses in Ireland and indeed throughout Europe have largely ignored gender. So we don't see women specifically mentioned. And alongside that, then we have a lack of gender sensitivity within service responses. And this is, of course, related to the fact that homeless service provision has traditionally been male oriented. I suppose understandable to some extent, because certainly historically, the largest proportion of those accessing homelessness accommodation are males, but yet, you know, there is this insensitivity related to gender very present. And I suppose in relation to that, all of that then, it's very important that we kind of look at and ask, why is this the case? And first of all, it's useful here to take this kind of historical lens and to acknowledge that basically that dominant constructions have depicted women often as deviant, as transgressive, and by implication as largely unworthy. And indeed, many early texts These are academic texts on homelessness, particularly emanating from the United States, in fact, characterized women, if indeed they did include women in their analyses, as sexually deviant and as essentially lacking the ability to live and function as women. And we often see this language embedded in these texts of, the eccentric bag lady, and there was often an underlying kind of assumption of sexual deviancy. Now, today, of course, the language used to describe women who experience homelessness is very different and is far more nuanced, but there is nonetheless some evidence of continuity in how women are viewed and their situations understood. And we can see this coming through in prevailing ideas about women, about home, about the family. And the persistence of constructions, traditional constructions of women's role, for example, as mothers, as carers, and the continuity of role differentiation within the family. And these constructions then become evidence or raise their heads, so to speak, again, then when we look at the language embedded within documents and within policy documents also. So for example, we see these particular categories of homeless women: single, lone parents, family, and these, as I say, are very visible in the bureaucratic and organizational structures governing the delivery of services and supports to women in many European countries. Now, there are other intersecting factors besides these kinds of constructions of women, the home, family, and so on, that also sort of bolster women's invisibility. And these include, but aren't limited to, the issue of measurement. Now, anybody who researches homelessness has some form of obsession with the issue of measurement or enumeration, and of course it is challenging. But many of our measurement techniques can obscure the extent of women's homelessness, as it can the extent of men's also. But then there are other reasons, and it will sort of maybe come through as well when I look at the service response, or women's experience of services, about women can make themselves invisible within services as well. And so women's responses to homelessness and to homelessness services can also serve to conceal their situations. And then we have the issue of more general of undercounting of women's homelessness. For example, in many countries, including Ireland, women who are accessing domestic violence services aren't counted as homeless. Also, we have other undercounting, for example, of women and indeed men in direct provision. So all of this, there are all of these, I suppose, pieces collectively can serve to undercount or render women less visible. Now, having said all of that, a growing body of research is contributing to a better and gendered understanding of homelessness. And when we think of a gender lens and gender perspectives, often what comes to the fore in the literature is that experiences such as childhood sexual abuse and violence, intimate partner violence or abuse, maternal trauma, all of these kinds of experiences have been demonstrated by research in Ireland and internationally to push women along a trajectory of housing stability and homelessness, and very often repeat homelessness. Now, these experiences, of course, they're not limited to women, but they are gendered. And possibly one of the strongest and most consistent indicators that gender matters pertains to the role of domestic and other forms of gender-based violence in women becoming homeless. And so that research across a range of jurisdictions, and we see this if we look at systematic reviews as well, if we look at scoping reviews of women's homelessness, published, and there are a couple of recently published reviews of such nature. They do tend to highlight adverse childhood experiences, and whereas whilst these aren't the ultimate cause or trigger to homelessness, there's a pattern, a very distinct pattern there. And Maeve Savage in her work has usefully highlighted as well what she describes as the disabling effect of effective injustices, including domestic abuse, experienced across the life's course among women who become homeless. And in fact, in the research I mentioned, conducted by myself and Sarah Sheridan, that was a study of a fairly large scale biographical study and longitudinal study of 60 homeless women. A staggering 92%, 55 of the women had experienced some form of violence or abuse during their lifetimes, and 55%, 33, had experienced violence during both childhood and adulthood. So what we're seeing here is violence across the life course, as Maeve described there. And these are very significant patterns, and they have, I think, really significant implications for service responses. And of course, we saw as well that the COVID-19 pandemic, during COVID-19, we saw rising numbers of girls and women experiencing homelessness, leading the World Health Organization to describe domestic violence as the shadow pandemic. So just to say a few things more or further about domestic violence and its relationship to women's homelessness. Well, there is evidence of a reinforcing relationship there, and there's no question about that relationship. It's across jurisdictions as well. We've seen it in Ireland, and the most recent piece there is work that I conducted with Fiona Neary on family homelessness and domestic violence that was funded by Focus Ireland and the Housing Agency. And again, we're looking at that complexity and the complex paths followed by women due to out of their homes and into homelessness because of domestic violence. And we also know that women who experience DV, they confront very strong barriers to housing stability, so that after they exit the abusive relationship, they can find it very hard and very difficult to become housed. This is, of course, related to a lack of affordable housing, also to housing market discrimination, and also because many marginalised women find it very hard to they're often parenting alone then at that point, find it hard to maintain labour market participation or to enter the labour market. So that we see what I suppose the pattern here is that leaving these relationships becomes a pathway to homelessness. And sometimes people find themselves choosing between homelessness and returning to an abusive partner. Because once out of home, of course, they find themselves in situations of precarity and without adequate financial support. So there is considerable evidence of women returning to abusive relationships. Now, of course, there are structural drivers of women's homelessness, and like men, these are strongly related to the lack of affordable housing. This is very clear in the Irish context, but we have similar situations across housing markets in the European context, in Australia, in the United States, and so on. So we know this, but I suppose again, and looking and taking a gender lens, there is a lot less talk about women's particular position within housing markets and of women's vulnerability to housing instability as a consequence. And this is despite the fact that, in fact, women's discrimination within housing market is, in fact, well documented. And what is also well documented, particularly for single women parenting alone, their precarious positions are recognised. And more broadly, housing has been recognised as one of the conduits or vehicles through which gender is mediated and sustained. And yet we have this situation where women's particular relationship with housing and housing markets tends not to be the subject of huge debate. And this is, as I said, despite evidence in Ireland and elsewhere of the fact that they face significant disadvantage in these contexts. And more recently, in terms of housing vulnerability, and we have the phenomenon of sex for rent. Now, this, in the Irish context, this was exposed through Primetime Investigates. I think it was it went out in November, or was it that late? I can't recall. Anyway, many of you may have seen it. Of course, we don't know the extent to which this phenomenon is out there. I know that the National Women's Council are doing some work in this space at the moment. I think Fergie Friend may be in attendance today, and we look forward to that, the publication of that research. What we do know, I suppose, from the international context is that this is really, as it's been described as poverty-fueled vulnerability among women, so that women who find themselves in these situations of exploitation or exploitative sexual harassment and exploitation within their housing situations in private rented accommodation, and more typically that they will be highly vulnerable financially or in terms of their income and ability to afford rent. Now, we have then the issue of we need to understand that not all women are equally vulnerable, and that women are a very heterogeneous group rather than a homogenous group. And we also very important to recognise that disadvantage intersects with other factors such as race, age, class, sexual identity, ethnicity, and so on. For example, migrant women's particular circumstances can render them especially at risk of housing instability and homelessness. Now, migrant women's homelessness can be associated with intimate partner violence, but those whose immigration status depends on that of their spouse are particularly vulnerable, for example, because they lose their legal status when they leave these relationships, and also face exclusion from both labour and housing markets at that juncture. Referring again to Maeve Savage's work, Maeve speaks about the intersectionality of gendered class relations and effective injustices, and there's disabling effects on women and girls. So these kinds of particular vulnerabilities are very important to acknowledge. And again, going back to the kinds of categorizations and the policy surrounding these categorizations of single women who are mothers, families, we need to be aware that these can reproduce dominant constructions of women, of mothers, mothering roles, home, and of homelessness. So moving beyond then, I suppose, acknowledging the importance of understanding the drivers of the importance of gender in driving as a driver of homelessness and women's vulnerability within housing markets. There is now considerable evidence that women's experience of and their responses to homelessness have distinguishing features. So I want to turn to women's experiences, women's service experiences at this point. Now, this is, I'm going to draw from this evidence review conducted by, for Fianza by Joe Bretherton and myself, and this was published during the pandemic, in fact, in 2001. So as part of this review, what we did was look at the evidence base on women's service experience. This is the evidence base internationally. And from our reading of the literature, we identified three dominant themes that sort of permeated these experiences on the part of women once they enter into the service system. The first was service avoidance, the second, diminished autonomy, and the third was this, I suppose, strand of women seeking solutions independently. Now, I'm kind of aware of time here, so I'm going to skip to, and I thought this might happen, so I'm going to skip to a, and I'm happy to have these slides shared, of course, after, and them emailed to people who are interested. But I'll skip on to, this is a summary slide of service avoidance, diminished responsibility, and women seeking solutions. So in relation to service avoidance, basically we have this piece of women seeking informal solutions. So they're staying temporarily, typically once they leave a home. And actually this theme came up a lot in our recent work on women and domestic violence. So they stay in situations of hidden homelessness, essentially. But also women avoiding hostels because of fear, because they feel threatened. And the other, I suppose, plank of the service avoidance relates to stigma, and the particular stigma related to being homeless as a woman. And it's 30 or more years since I think a reference was made to the particular stigma of the unaccommodated woman. So there is this piece of service avoidance. But then, of course, women do eventually enter into the service system or are forced to. And within the service system, they often experience feeling judged, feeling infantilized. There's the stigma of lost motherhood, going back to these women who have lost their children, who have left, or whose children have been taken into care, and so on. The rules and regulations within service systems leading to women feeling subservient, and so on. Now, and some of these are the subservience, that's, men can feel that as well, but there are particular kinds of I suppose, experiences for women here, and ways in which, and much of it centres very often on this notion of femininity and motherhood. And finally, the issue of women seeking solutions. Basically, women leaving the service system independently, seeking, often ending up in low quality of accommodation, but this ultimately leading to a cycle of returning and cycling and peddling in and out of homelessness. And all along these journeys, women are seeking ontological security. And very important to point out that migrant women's needs within services are quite specific and frequently not met. And this is an issue, I suppose. I mean, throughout Europe, we now have the whole migration piece, and it being very significant within homelessness services and within the whole homeless service sector. Now, just to give, I suppose, a flavour of women's voices here from this body of literature, here we have a woman, we go in referring to a shelter, it's like they're treating us like kids, talking to us like kids that have kids. I took this next quote from a Canadian study. The system is set up so the worker is spending lots of time recording information about you, but not much time giving actual help. And this relates to as well to the significant bureaucratic, I suppose, piece that women experience, and of course men do as well. But women would have told us as well that they start to scale back their story at certain points, or they just get tired of telling the same thing. Also, it's re-traumatizing. Here in this Midwestern US study, this woman just asking for recognition. In the same study, I have a fear that they will say stuff to children's services. Will this be turned in? This fear of losing children, particularly women who have to report domestic violence or abuse. Here in a UK study, I didn't get the help I needed. They didn't have counselling. So these supports, psychological supports and so on. And here in the UK, again, my biggest concern is getting rehoused and getting settled with my kids, but that never seems to be a priority. And that's from a woman who had left home, again, because of domestic violence. Now, there is evidence as well of the enabling impact of positive service experience. And this evidence is very important because it points to a way for us to improve service provision for women. So studies have also very much pointed to the benefits women derive from service interactions where they experience compassion and respect. So here, this is from our own work. This woman spoke about her key worker. She was the best. She was the one I actually really opened up to. I went through a lot with her and learned a lot. And Paradis and colleagues in the Canadian context have highlighted the importance of what they described as principles of dignity, autonomy, and self-determination if women are to successfully engage with service providers. And again, in our own work, we found evidence that accommodation that catered to the needs of a small number of women, as opposed to a large number, were often felt to be more conducive to basically rebuilding their lives, and encouraging a personal sense of empowerment. And these living situations also tended to be less chaotic for the women. This woman here talks about the domestic violence refuge. It was a place where people were advising me. They were telling me about my rights, women's rights, helping to build my confidence, how to come back to myself. And a lot of women did talk, in fact, very strongly about this process of regaining a sense of selfhood. And again, Bina, who's in the domestic violence refuge, felt listened to. They believe and they try to help you, and that is the most important thing you need when you're just shattered and broken. So moving then finally to policy and service responses to women's homelessness. Now, historically, we have had, linked to the constructions I mentioned earlier. Historically, women have been managed through institutions, religious or evangelical communities, and so on, all primarily designed to manage women's perceived deviancy. And really, in this context, women were classified as something other than homeless, and they were othered also in that context. Now, of course, today the nature of service provision for women who experience homelessness is very different, but we do see an enduring reliance on homeless shelters or other emergency accommodation to house homeless women in most European countries. And this does represent a significant point of continuity. Now, a recent analysis, European level analysis of national strategic approaches to homelessness did find that the staircase model of service provision dominates, despite the fact, of course, that we have a significant move towards housing-led and housing first approaches. We do know also that women can access women-only services in a number of countries, including in Ireland. But that these kinds of provisions, they're far fewer in number than mixed gender facilities. Now, there is also to say that among women who are asked about their preferences, many will say I would prefer a women-only service, but not all opt for that. But what does appear to be important is that there are women-only spaces within mixed gender settings. Now, in 2020, Fianza published a guide for developing effective gender support and solutions to women experiencing homelessness. And what they say in relation to these services is that women-only services are run by female staff for women, and they're crucial for women on both an emotional and physical level. Women-only spaces provide safety and allow women to speak freely about their experiences. if a service is mixed, it is important to ensure women-only activities and spaces are provided by female staff. So there is certainly greater recognition than previously of women's needs within homelessness services. One, I think, distinct problem that we do have is that in relation to addressing domestic violence and homelessness is that they're often seen as separate issues. And as a consequence, they're dealt with by separate systems. And this disconnect between homelessness and domestic violence services is well recognised internationally for some time. And again, in that piece of research on family homelessness and domestic violence conducted by myself and Fiona Neary, we interviewed a lot of stakeholders there, service sector, from both the domestic violence service sector, home service sector, and we also interviewed local authority personnel. And this theme permeated. We've made a lot of recommendations in that report for trying to address this disconnect and the fact that these service sectors tend to operate in silos with a relatively poor understanding of what each sector is doing. And this need for better coordination and integration of responses to homelessness and domestic violence has also been, has been discussed at a European level. Here, Nicholas Police and colleagues say there should be further cooperation and exchange between homelessness and domestic violence services with a view to better responding to the needs of women escaping violence and using homelessness support services, and to improving the housing outcomes and support provided within the DV sector. And just finally to say something about Housing First for women. Of course, in Ireland, we are moving in this. This is, I suppose, the direction we're trying to move towards, Housing First and housing-led approaches. But women don't feature very strongly within these discussions, within policy documents. And this is the case, of course, internationally. And also internationally, Housing First for Women is very underdeveloped. And the, I suppose, more as problematic is that the research evidence base is on Housing First for Women is very limited throughout Europe and indeed in the United States, where Housing First was first trialed, if you like. Now, this recent study by Deborah Quilgars and colleagues, it's a relatively small scale evaluation of Housing First, threshold Housing First in the United Kingdom. And they, the three, I suppose, significant or big take-home messages from this report, they emphasised a trauma-informed and attachment-aware support approach to the delivery of services for women. This is very much in line, interestingly enough, with some of the data I've talked about earlier in relation to these histories of adversity and stemming from childhood among women. Then these patterns are very consistent now across the literature. They also, importantly, and linking back to issues that I spoke about earlier, they really place strong emphasis on services that recognise that many women, so-called single women, who are accessing these services are mothers, and that they need support with coming to terms with the loss of their children, and they need help to work in a positive and constructive way to maintaining contact and reconnecting with their children and also with their wider families. And this study also emphasised the need for a close working relationship with the domestic violence sector, that's between the homeless service sector and the domestic violence service sector, and the provision of accommodation that's safe and secure as a first priority. So just to draw some conclusions. So discourses are shifting, and that's positive. And I do think the nature of the debate on women's homelessness has changed, and that's also positive. We do have a lack of basic data on women's homelessness. Undercounting is a problem, but I think also as significant is that we don't know enough about the women's homelessness journeys, if you like, what enables them to get out of homelessness. We need to look at different, I suppose, subpopulations within the overall population of women who experience homelessness, including younger women, LGBTQI plus women, also migrant women. So there are different sort of, I think these experiences can be different, and we don't know enough, as I say, about their trajectories through and out of homelessness. And some research in that area would be timely. Homelessness policy across Europe has historically ignored gender, largely ignored gender, and failed to address the complexity and diversity of women's homelessness experiences. This is shifting in a positive direction, but more needs to be done. And a gender perspective on homelessness does need to be far more explicitly embedded and articulated within homelessness policy. Also, we see from the evidence base, both in Ireland and internationally, that we need service responses that better acknowledge the diverse situations and experiences of women. And finally, I think we need to work harder to respond effectively and comprehensively to the needs of women who experience homelessness. So thank you for attending, for being here, and questions and discussions are, of course, welcome.
Thank you, Paula. Firstly, that was incredibly comprehensive and a really interesting way of structuring it. So you sort of took us through the research and into solutions and some of the ways that we can go forward, but also some of the ways that we have to continue to develop our understanding. So I think that's superb. There was one question early on which I didn't respond to, which is it being recorded and shared later? And the answer is yes. And Paul has already said she's happy for the slides to be shared, so that will be emailed to all the participants today. So thanks to Paula for that. So if people want to put in their questions into the Q&A box or into the chat, we'll address them. But I think just as an opening question, one of the things in the earlier slide, you talked about women's precariousness in housing. And can you just talk a little bit about the elements of that? I suppose we do know in the homeless figures, obviously single parents and female-headed households, that's obviously very clearly in large part an income issue. But I'm just wondering, is there more elements to that we should give broader consideration to?
Yeah, I mean, the place that we see it most strongly is in relation to women who are parenting alone. And because of the way in which, I suppose, and this landscape does change when, I suppose, social protections change and so on. But women find it very difficult to engage with the labour market because of childcare issues and so on. So that's one very, I suppose, significant and big challenge. And it's particularly strong in a context where the housing market is so competitive, and where perhaps as well, the preference out there can be for singles who are working in professional jobs. They're seen as more reliable tenants and so on. So there are all of those, that there's that piece. And I think then in relation to women's vulnerability as well, of course, we do have the whole piece of women leaving an abusive relationship and finding themselves again in a situation where they're essentially single moms and they don't have they're no longer in a double income household. And you see our housing market, our housing structures, and the way in which our housing market is structured. It's built on a family model, really, um, and and historically on a male breadwinner model. So we have all of these kinds of structural pieces as well. So it is a complex landscape, but certainly women have a particular relationship with housing that is often linked to their children, and also, and then the landscape that they face, particularly at the moment, is very challenging.
Thanks for that. Sorry, I'll quickly start going through the more questions here. So, can we identify a difference in experience in traveller women?
Yeah, yes, there are, and again, I mean, even based on our own research, this is something we could look at more closely. I do think there are yes, it's. I think that, and I think that traveller women will have very particular experiences as well within the service sector, if you like, and very often they can be very reluctant to engage with the service sector. In terms of, there's a lot of fear among traveller women in terms of entering into the service sector. And that fear as well is compounded if there is domestic violence and abuse. So, and of course, we have the other piece, traveller women exiting. There will be very specific barriers there as well. But I think that this is an area we have included traveller women in our research, but our samples aren't large enough to draw really firm conclusions there. Yeah. But I think that anybody here from the service sector would have lots of insights as well into that.
Absolutely. Would homeless women coming out of addiction be included in the official homeless stats too?
In anybody in the homeless statistics?
Yeah.
Yeah, I mean, all the information from the PASS data set, yeah, it will include anybody who has an addiction problem, who's accessing any of the emergency PEAs, STAs, and so on. And now we know from research both in Ireland and internationally that there's a very big difference between women in family homelessness and women in singles. Families are far less likely to exhibit these kinds of complex needs in relation to addiction and mental health, which is not to say it doesn't exist at all. But what we'll see is far more of addiction, complex addiction, overlapping mental health issues among single women, which is similar to single men. Yeah, but they are counted in the figures. Yeah.
So how is the Irish experience of homelessness among women different than in other countries, be it in terms of the situation, context, and/or policies and action? There's about 6 questions in there.
Okay.
Yeah.
I think there are a lot of similarities between, certainly my reading of the existing literature, at least, of women across jurisdictions, whether it's across Europe. Now, we do have huge deficits of information in countries across Europe. That situation is improving. We're probably ahead in what we know about women's homelessness, slightly ahead of some countries in Europe. But we do have, that whole, in terms of women, the path into homelessness, we know a good deal about that. And as I mentioned during the presentation, the pattern, the process, in other words, leading to their homelessness can be very different to the trigger. So a trigger could be the sudden loss of accommodation but what lay behind that? And very often we'll see these, particularly among women who are homeless as adult only, whether they are indeed mothers, they will have a complexity of need in relation very often to trauma, to childhood trauma, and so on. In terms of, if we jump then to, I mentioned that in most countries, we don't know enough at all about women's movement through the service sector. We know a little bit in Ireland. We've published one article on it, but it's about women cycling the service sector. Like, in relation, just to say, many women experience, more so than is often recognised, experience long-term homelessness. So they're in service systems for a very protracted period of time. And that of course is related to the poor exit routes and so on. And that we do have considered, there is evidence of that also in the UK and in Australia, for example. But jumping then to, I suppose, the policy responses, yeah, we're pretty much, we're in, I think internationally, policy responses to women's homelessness have been far weaker, that the policy responses often fail to make distinctions in relation to what needs to be done in terms of gender, and recognize that, that women are different, or women's needs may be different. They're not all, some of their needs are the same, but other. So I think that overall, we're pretty much a mirror image almost of what is happening internationally. I don't see any major difference. There have been a couple of Housing First initiatives in the UK and elsewhere, but they're small scale as well. Yeah.
Okay. So, sorry, I'm going to keep going because we've lots of questions, which is great. Do keep them coming. Consideration for pregnant women, especially first-time mothers who are often very young with little or no support network. So I guess that's a question about, are there services out there for women in that situation, or do they need to be specific?
Yeah, particularly for young women. This is written into the youth homelessness strategy as an action, and it's quite important. So that is being worked on. I know that at the moment, but certainly, yes. But most importantly, women who are pregnant should not be in these services. Young women who are pregnant.
Absolutely.
Priority is to get them out of these services. Yeah.
I suppose this is a practical question. Would you recommend local homeless action teams increase their membership to include domestic violence and other NGO services?
That would be really positive, because I think there's a huge need to share information across the sectors. I think there's a huge need to learn, but but also I think there's a really big need for a much better and tighter interagency working there.
Yeah, and I think in my recollection, when I started in the sector back in, it's almost 20 years ago now, but actually domestic violence services were much more integrated with the homeless sector in terms of their contact through things like the what was then the homeless agency. But when the funding got separated,
yeah,
they went their own way.
Yeah, funding streams are very influential in how people work together. I see a question there from somebody asking the pregnant women again. Any research on there isn't research specifically, to my knowledge, on pregnant women accessing homelessness services, and I don't know what these figures are. It may be possible that people know, but I don't know them. So Norma, thanks for that question. I see your name there.
Research into female-specific issues are in general appear to have less interest than male issues. So is this changing now? Is there more interest in researching women's issues? I'm thinking, e.g., of female hormones and the impact of substance use, etc.
I think so. I think there's a huge amount of scope there for further research. When we drill down, it's interesting. There, the questions have been asked about traveller women. It's a huge gap in research there. Pregnant women, so yeah, we do need to know more about these particular groups. But I also think we have a fair enough amount to go on to build a discourse on gender, to build it more substantially into policy and service provision as well. And and to continue to build on that. Mm-hmm.
Okay. I'm going to jump right because there's been a couple of themes here, so I just want to um, just for the time we have left. Do you think women or people experiencing homelessness may feel little autonomy when living within homeless services? I think that did come out in your research, didn't it?
Yeah, so the question is, why do I think?
Oh, why? Sorry.
Yeah, why? Yeah, I see that question. Yeah, that's an interesting question. I mean, I suppose, yeah, I mean, and again, it's not that that's limited to women either. I remember, in fact, when Sarah Sheridan and I started the research on the women, and we were in a mixed service, and one man said to us, why aren't you interviewing us as well? And um, so the autonomy, I mean, none of us would feel autonomous living in a homeless shelter. And then, but I think that what came out in our research, because there was a big ethnographic component where time was spent with women. And during that time, it was the issues around, often about children and motherhood came up. And it's that kind of lack of autonomy. They feel they hadn't even told service providers in some cases that they were mothers. So this is the kind of a lack of recognition and autonomy that women can specifically experience.
I wonder if also in that context, it's because when I started working in services, I remember the assessment, which has improved a lot, I have to say, in that time, but it was really around what could the service do for people. So you were asking them to tick the box to see of the services you had, which ones they need, rather than actually taking that kind of holistic approach.
Yeah.
Are there any housing first led models in other jurisdictions that you would consider as being worthy of further scrutiny in relation to women's parenting alone and how the state is supporting this cohort in terms of prevention of homelessness and in terms of exiting homelessness?
Exiting homelessness, okay. Okay, I'm just looking at that question now. Housing first models in other jurisdictions. Yeah, you see, there's so little for women. I'm not aware. Now, there could be. Carly, I mean, but I'm certainly not. The Housing First for Women evidence base is very, very small. And where it is in train, or where it has been done, like all Housing First models, it tends to target women with the most complex needs rather than those parenting alone. Do you see? Like, it'll target the substance use disorder, mental health, dual diagnosis, all of that. And sometimes those women might be slightly older rather than very, very young and parenting alone. So I'm certainly not aware. But again, I mean, I think that the approach to women who are parenting, they will, in a lot of jurisdictions, they will be prioritized for housing, for social housing. But the problem is that the social housing waiting lists are very, very long. So, but no, in terms of Housing First models, I'm not aware of any that address parenting alone specifically.
Okay. I'm bouncing around here. So now, again, excellent point about the Irish housing model is based around traditional family unit. Is there research available in other countries with higher single unit stock, which may show more positive outcomes for women's health and independence overall, and by extension, less female homelessness?
Okay, I'm just trying to find that.
It's the second last question. Scroll right down.
GB. Oh, yes. Okay. Is there research available in other countries with higher single unit stock, which may show more positive outcomes for women's health? I'm not aware, but certainly the point about higher or single units in we don't in our social housing is typically it's more the unit, it's 2-3 bedroom houses. So we don't have this stock of social housing that is like 1-bed apartments or 2-bed apartments. So in countries that do have a public or social housing stock of that nature, you would expect that their exits from homelessness would be faster, for sure, with smaller families or single parents. Yeah.
Okay. So go back to, is there a discussion to be had about allowing visitors to women's accommodation services? I guess this comes in, you talked a lot about the isolation and the
Yes, yeah. I mean, it's hard. It's a difficult one because of for example, in domestic violence shelters, it's very strict rules of access, obviously for safety reasons. I think that um, I think that some services do allow some visitors, but certainly visitors are important for women. But I think all of that is easier when we have service contexts that are smaller in nature, because it's easier to control visitors in and out and have maybe sign-in systems or some kind of, because safety has to be an issue, and particularly where there are children involved, maybe children visiting and so on.
So I'm conscious now we're now a minute over our time, and Paula also has lots of other duties. But I'll ask the one last question: Did any evidence of women being displaced from familial community support after entering EADV refuges come up in your research? Particularly relevant given there are many counties in Ireland who do not have DV services, and people having to travel in order to access emergency accommodation. So I suppose it's about that hidden homelessness, the nature of women's homelessness as well.
Any evidence of women, displaced from familiar communities? Yes, well, women are always displaced from their communities once they enter into either the domestic violence service sector or the homeless service sector. Even if they're, yes, people do have to travel to access domestic violence services, but also people leave, their home in Coolock to access a service in the city centre, for example, whether it's a homeless service or a domestic violence service at the other end of the city. So they're women, yes, women experience huge displacement from their communities, and and with family ties as well. Yeah, absolutely.
So I think just conscious of time, I'm going to finish up there. Thank you to everyone for such a vibrant engagement. It's really positive to see, particularly on such an important. I would give a little plug to to Paula's and Sarah Sheridan's study from 2012 on women's experience of homelessness as an ethnographic study with the real voices of the women coming through it. I think as a starting point for understanding women's of homelessness, I think it's seminal. And really important in the Irish context as well to give us a structure. So I think once you get Paula's slides, there's lots of other reading in there as well that should absolutely be engaged with. But I think as a piece that certainly informed my understanding of women's homelessness, it was really, really seminal for me. So with that, I'm going to thank everybody and thank Paula again. And I do hope you'll join us for the next assignment talk, which I believe will be on dealing with vacancy. But for now, just to thank Paula again.
Okay, thanks everybody.